County. I'm running for House District 18. With the unenviable task of trying to replace the irreplaceable Michael Merrifield. But I take this on with enthusiasm and excitement. Thanks too to Chuck Bader and our other union brothers for putting this gathering together. This is a tremendous showing of solidarity in favor of probably one of the most important issues that we're facing today. So thanks to Chuck and thanks to Mike Serbo from the AFL-CIO president for coming down from Denver. The U.S. provides some of the best health care in the world. Hospitals like Johns Hopkins, the Mayo Clinic, Sloan Kettering draw patients from around the world. Our medical schools, Harvard, Pennsylvania, UCLA, are top-notch and turn out some of the absolute best doctors in the world. Our pharmaceutical companies develop miracle drugs which ease pain and take care of diseases which were killers just a decade or two ago. We in the United States lead the world in Nobel Prize winners for scientific research. Without a doubt, the U.S. provides some of the best health care in the world. We hear this every day from those opposing health care and health insurance reform in this country. So why do we need reform? We need reform, as Michael Merrifield said, because our health care in the U.S. is too costly for some, unavailable to many, and unsatisfactory to most. We have 800,000 Coloradans without health insurance. 116,000 of our neighbors in El Paso County alone lack health insurance, and 48 million across the United States lack health insurance. We need reform because many of the insured are one pink slip away from being unemployed and thus uninsured. We need reform. We need reform because the system of tying health insurance to employment does not work in an economy where 10% of the people are unemployed and 25 to 30% of the people are underemployed or working in jobs without benefits.
Yeah.
We need reform because the unregulated free market model based strictly on profit does not work for health care because it encourages denial of claims and shifting of costs to consumers with ever-increasing premiums. We need reform because a country where the leading cause of bankruptcy is inability to pay medical bills is ethically bankrupt. It is absolutely unconscionable. Now, I am an unapologetic supporter of market-based capitalism. The market-based economic system has enabled this country to achieve wealth and prosperity unknown in history, but it does not work for health care. We need a regulated system that prohibits denial of coverage due to pre-existing conditions. We need a regulated system that prohibits cancellation of coverage and premium increases due to illness. We need a healthcare system that allows portability so you can keep your insurance when you change employers or become unemployed. We need a regulated system that pays for preventative care and encourages people to have healthy lifestyles, which tells people to get care before they get sick or before they get more sick. We need a regulated system that allows people who are satisfied with their existing coverage to keep it, but allows anyone who can't afford it or who wants to change to get it through a public option or a single payer system. The one absolute certainty of this issue is that the present system is flawed and cannot continue, or we as a country will be both bankrupt and sick. So don't believe those who tell you that America's healthcare system is great and that it works, because that's only half true. Get the facts and work for what you need, healthcare for all Americans. Thank you.